Hello, everyone, and welcome to our Facebook Live session today. My name is Rachael Hodges, and thank you all for joining today. I will give you all a few minutes to kind of join us and get started. Um, this is my first live session, so we'll see how this goes. We will do our best to kind of move around the camera today. I'm starting here at the College of Nursing in one of our lab spaces. I'm currently sitting on one of our beds, but then I will move to the floor as we start looking at BLS basics and starting to kind of practice around with our mannequins. So to get started, I'm going to give you a little bit of my background information and how I was asked to do a Facebook Live session today. As you might have seen, I'm a UTK Knoxville alum, and I graduated from here in 2015 with a Bachelor of Science in Nursing. I actually also have two minors from UT. One of them is in Child and Family Studies, and the other is in Psychology. So I am a true Vol for life and am enjoying being here on campus. My work history is not super long, but after I graduated nursing school here, I worked at two other facilities in Knoxville. Well, one in Knoxville and then one in Chattanooga. And I worked in a neonatal intensive care unit in both places. And then in 2017, I came back to the College of Nursing to work where I went to school. And I've been here since then, so July marks my 3-year anniversary here with the College of Nursing. And I am the simulation coordinator for the college. So anything that nursing students do that is related to learning a skill or practicing a skill on a mannequin or doing a scenario where they're interacting with a mannequin or what's called a standardized patient, that's my job. So I am back at my alma mater in the college I graduated from working with our nursing students. So that's pretty fun, and it's a very interesting job. So today we're going to talk a little bit about BLS and some key points that you'll want to know when we're doing BLS. So BLS stands for Basic Life Support, and you can also hear it termed CPR, which is cardiopulmonary resuscitation, and the two terms mean the same thing. So BLS and CPR are the same. And we started teaching BLS to our incoming nursing students about probably 4 years ago because they need it before they go into the clinical sites. So we want to make sure that we're able to get our nursing students certified before they start their clinicals. And the best way to do that is for our faculty and for our staff to teach it to them. And so that responsibility, that's one of the things I do on a daily basis or on a monthly basis, I would say, is organize and kind of teach our BLS courses. So a lot of people, they know a little bit about BLS and they know a few basics, but I wanted to share with you um, the key points of how to do BLS if you're not a certified person. Now, anyone can become certified in BLS. You can do it by taking an in-person course that usually lasts about 4 hours, or you can take a blended course where you do some learning online and then you do a testing session in person. But anyone is able to take BLS or a CPR course. And there's two companies that you can take BLS with. One of them is called the American Heart Association, and the other one is called American Red Cross. So the College of Nursing is aligned with the American Heart Association, so that's what I'm going to teach you about today, is guidelines from AHA. I'm sure they're very similar to American Red Cross, but we're going to look at AHA. And I've also went through and picked some information and pieces that were going to be important for 3 groups of people, for adults, for pediatric patients, and for infants. Now, you might think peds and infants are the same, but they're a little bit different. So I'm going to go ahead and move the computer now to the floor because to do BLS in the most appropriate way, you do it in the floor. So hang with me as I move my computer down, and I'll show you the mannequins that we use to do BLS with. So as you can see, we're now in the floor with our BLS mannequins. So what I would suggest is that you grab something to practice along with. And maybe that means you grab a pillow or a doll or a stuffed animal, something that you can practice along with. And so the first set of key points that we're going to go through is for adults. And then we will look at peds patients, and then we will look at infants patients. All right? So I'm going to show you what my adult mannequin looks like. And this is my adult mannequin right here. Anytime you take a CPR or BLS class, this is what the mannequin is you're going to see. These are just classic type mannequins, but it's supposed to represent an adult. So this is what we're going to practice with first. So if you know anything at all so far, the reason that we do BLS and life-saving support is because people have what's called cardiac arrest episodes. And cardiac arrest is when somebody's heart is out of rhythm and is not beating appropriately. And it gives all these crazy rhythms and gives you crazy heartbeats or no heartbeats at all. And so that's why we want to do BLS for people, is to get back that rhythm or to give them a rhythm by us pressing on their chest until one comes back. And so it's the same concept for adults, peds, or children. So the first thing we're going to do when we see a patient of any age or size collapse on the ground, we need to do a couple things. We first need to make sure that the scene is safe, that we can approach the scene and be careful with what we're about to do. We don't want to endanger ourselves and the patient we're going to perform BLS for. So we want to make sure that the scene is safe, that we can approach, and that we're not going to injure ourselves. The second thing that's really, really important that we need to do is we need to alert EMS. We need to call 911 and let them know that somebody is having a cardiac arrest or that somebody has collapsed and we don't know what the problem is. We need to let someone know that someone is not okay. So we're going to make sure the scene is safe. We're going to let someone know that we have a patient who's not doing well. And then the next thing we need to do is identify if our patient has a pulse or abnormal breathing or no breathing. And the best way to do that is to check a carotid pulse. Now, a carotid pulse is in a neck. So the way you do that is to put 2 fingers right below your jawline, and you'll be able to hear your heartbeat or feel your heartbeat. If you go to check a person and they don't have a heartbeat and they're not breathing, that's when we need to begin CPR and BLS. So let me show you what that looks like. So I'm going to approach a person and make sure they don't have any breathing or any pulse rate, and that's when we would do CPR, okay? And to do CPR with an adult, we need to follow a certain rate. So we need to press on their chest between 100 and 120 beats per minute, which is pretty fast. So what we also need to do is put in breaths in between our compressions. So we need to press really hard and press fast, but we also need to give them 30 compressions to 2 breaths. And we just continue to do that until EMS arrives or till the person regains consciousness. So 30 to 2 breaths, 30 to 2 breaths. And we have to press pretty hard on the person's chest. It needs to go, we need to compress the chest about 2 inches or 5 centimeters and allow the chest to completely recoil before we go and start another set of 30 compressions. That allows oxygen and air to reach the person's heart, and then it goes throughout their entire body so that we can perfuse their brain and their heart appropriately. So then we just continue to do that until help arrives. And whether you are alone or whether you are with another person, the compression ratio to breath ratio is the same. It's always going to be 30 to 2 if you're by yourself or if you're not by yourself. So that's what we'll do. And I'm also going to show you how I'm going to breathe for this patient. This is called a pocket mask right here. And this pocket mask goes right over my patient's face, just like this. And this is how I'm going to breathe for them because I don't want to put my mouth onto this patient's mouth. If you're in a situation where you don't feel comfortable putting your mouth on a stranger's mouth, that's okay. You don't have to do rescue breaths. But it is important to push hard and to push fast on a patient's chest. And what we need to do is make sure that we are tilting this person's head to allow air to go into the lungs, and then we'll see the chest rise with air. So I'm going to put this all together for you all now, and I'll do a practice run and so you can see what that looks like, and feel free to follow along with your doll or pillow, whatever you'd like to do to practice, okay? Now this mannequin will make a clicking sound, and that's all right. That just lets me know that I'm at the appropriate depth. All right? So, remember, we need to assess the scene to make sure it's safe. And I'm in a safe scene here. I'm not going to hurt myself. Then I need to make sure that the person is unresponsive or doesn't have a pulse. So I'll run up to them. Sir, are you okay? Can you hear me? Sir? Then check the pulse. I don't feel a pulse. I'm checking for breathing. I don't see any breathing or chest rise. And then I need to begin compressions. And I'm going to put my hands right on their breastbone, right in between the nipple line to push hard and fast. Okay? Ready? Let's begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And that's one set of compressions and breaths. That's just one set. So we would continue that until help arrives. We can also ask other people to help after we do that 5 times because it gets really tiring really quickly. So I'm going to move on now to tell you some differences between adults and children. So I have another pediatric mannequin here. And a peds mannequin is a little smaller. See, he's a little smaller. And there are a couple differences between pediatric and adult CPR. One of them is that adults generally have cardiac arrest issues when something is wrong with their heart. Pediatric patients generally have cardiac issues when something is wrong with their respiratory system. So maybe they've choked on a piece of food and they're not breathing appropriately anymore. So then the next thing that starts to happen is their heart rate really slows or stops pumping. So typically a child will have a cardiac arrest episode when they're having a respiratory issue. So that's important to know because it's really important to begin breaths early for children. And we can do that in one of 2 ways. We can either give mouth to mouth if we want to do that, or we can still use our smaller pocket mask. and put right over their mouth. And it also changes a little bit when you're doing one rescuer CPR versus two rescuer CPR. So the compression to breath ratio when you're by yourself with a pediatric patient who has not gone into puberty yet, you want to do 30 to 2 compressions. 30 compressions to 2 breaths. If there are 2 people helping give CPR to a pediatric patient, your ratio then becomes 15 to 2. So it's 15 compressions to 2 breaths. The reason is because we need to give breaths more frequently. So 1 compressor, 30 to 2, 2 compressors, 15 to 2. It's the same kind of area. We're pushing on the middle of the chest. We're pushing really hard we're going to push at about 2 inches as well. And we still need to do the same thing, which is check for a pulse, check for breathing, and then begin CPR. So I will show you, we'll pretend that I have a second rescuer, and we'll go over 15 to 2 instead of the 30 to 2. All right? So I'm going to lay my patient down. I have my pocket mask. I'm going to put it together and I have it ready. So I'll start from the beginning. Junior, can you hear me? Are you okay? No? Okay, I need somebody to go ahead and call 911, please. Checking for pulse. Checking for breathing. I don't see any. I need to begin CPR. I'm going to do to 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then I will breathe for them. And then that's when I could switch with my partner who is helping, so that we don't get tired too quickly. We don't wear ourselves out. So then the next piece here is for an infant. And an infant is described as anyone under the age of 1. So a small baby. I have my baby here. Under the age of 1. And it's the same concept when you're giving babies BLS as adults or the pediatric group, but again, there's a few differences. So obviously, I can't get a baby to respond to me yes or no. They couldn't speak to me. So that will be a little challenging. And we also know that babies have really fat necks. And that's good because fat babies are a good thing. But it's hard to check a pulse at the carotid artery on a baby. So where we check a pulse on a baby is on their arm. We check it on their arm in between their shoulder and their elbow, and we press hard on the inside of their arm. We don't press hard enough to hurt them or to bruise them, but an artery is pretty deep in your skin. So just placing your fingers here on the arm, you won't be able to feel it. So we have to press a little hard to be able to feel if there's a pulse. If the baby or the pediatric mannequin or the pediatric patient, if neither one of them have a pulse that's higher than 60, we need to start BLS. So even if they have a heart rate of 59, we need to go ahead and start CPR because clearly they're having some respiratory issues. And the other thing with babies is it's very similar to the pediatric mannequin in that if there are 2 people who are helping with CPR, we need to give 15 to 2. So we do 15 compressions to 2 breaths. If there's 1 person, we still do a 30 to 2. One of the other differences with infants is our hand placement. If we have 2 rescuers and we're doing 15 to 2, we do what's called a hands encircling method. Let me show you. It looks like this. So I have my hands around the back of the baby, and my thumbs are right here in the center of their chest. And that's how I would compress, like that. If I'm just by myself, I use 2 fingers and press like this. It's a little bit easier to compress when you're around the back, but that's also when we have 2 rescuers. So I will show you both ways on a baby from start to finish so that you know how to do that. And then I'll take some questions at the end. So we're going to do the same thing we did with the adults, which is make sure the scene is safe. Then we need to see that the baby is responsive or not breathing, and then we begin. I will do 30 to 2 first, and then I'll show you what the 15 to 2 looks like. Okay? Scene is safe. Baby, are you okay? Can you hear me? Are you okay? Checking the pulse. I don't feel a pulse. I don't hear them breathing. So I'll begin CPR, and I've called 911. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. All right. So now let's pretend that I have a second rescuer, and they're going to help me with this baby. So they're going to help me. They're going to help breathe for the baby. So I'm just going to do the fingers. All right. I'll start from the beginning. The scene is safe. I'm not going to injure myself by helping this baby. Baby, are you okay? Can you hear me? Are you okay? Checking for pulse. Checking for breathing. There's no pulse or no breathing. I've got someone here to help me. I'm going to do my 15 to 2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And they're breathing for them. They're breathing for them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Breathing, breathing. So those are the basics of CPR. The most important things to remember are that we need to continue CPR until someone arrives to help. So sometimes that may take a long time. Sometimes it may not take it long at all. And if we have help or people are around you, it's best to have them help you because it really does wear you out and make you really tired. So what you can do is have someone else call 911 or have someone else breathe for the patient while you're doing CPR and while you're doing compressions. And it's important to switch if you have help to prevent yourself from getting overly tired. So what you can do is you do 5 cycles of compressions and breaths, and then you switch with your partner. And that keeps you all from getting really tired. So I'm going to go ahead and read to see if there are any comments here. There's like one, while we were continuing CPR waiting for EMT to arrive, do we check for pulses between every set of compressions? I would suggest that you do 5 cycles, which is 2 minutes before you check for pulses. The reason is we want to try to prevent as much interruption time in compressions as possible. And it automatically allows you 2 minutes to recheck that. So it's important you do 5 cycles, 2 minutes, then you can check for pulse again if it's returned. And then you'll switch partners too, and that's a good time to do that. Ideally, we don't want to interrupt compressions and breaths. The guideline is less than 10 seconds. So we've only got 10 seconds to switch with our partner to breathe for them and then check for a pulse. Are there any other questions here before we end our session and our time together today? Did I answer everyone? Any other questions? I think I'm finding the questions correctly. It's hard to tell exactly, but so key important points to remember: 30 compressions for 2 breaths. Continue until you have to stop or someone arrives for help for adults. If you're alone with a child, it's 30 to 2. If you have help, it's 15 to 2. You're welcome, Jordan. I see you. Yes, you're welcome. And then for infants, it's also 1 rescuer, 30 to 2, and 2 rescuers, 15 to 2. Push hard, push fast in the center of the chest, and you may save a life. You never know. So if you're interested in taking the full course, a full CPR course, you can look up the providers in the Knoxville area or wherever you are, and you can always enroll in a course and get the certification. Again, the 2 companies that do certifications are American Heart Association, which is the one that we covered today, and you can also do American Red Cross. So I hope this has been helpful and beneficial for you all. I hope that you have a great July 4th weekend, and I hope that you can save someone's life if you need to. Alrighty, I'll see you later. Thanks for joining today.